Okay, so let's try again. And what we're talking about is innovation in health, or my variation on it. But I hope we can all help one another, as I've said repeatedly. So this is a while ago. I was not stuck. I was on holiday, but I had an iPad and I had an idea, and I'm not Steve Jobs, but Steve Jobs was famous for pinching other people's ideas. He also learned calligraphy when he was in India in his early 20s, I think, and they included it when they brought out the Mac. So, and he used it in a later date. He also, one of the things he did, we don't use them so much now, but the mouse that he used, he got from Rank Xerox. So he bought this thing off them. Anyway, it had a bit of thing to the side, which was the mouse, which is what he was interested. He wasn't interested in the thing Rank Xerox sold him. And yeah, so I've pinched this. So I just, you play around, and when I say I've pinched it, the picture used to be on our sweatshirts, but I couldn't find one, so I had to go at doing them. But what he says is true, is that the really clever thing is to improve our health and wriggle out of treatment. But obviously we get paid more when things go wrong. So anyway, I looked into how I could do it. I had no idea it was called eHealth product. In America, it's called mHealth, mobile health product. And, so most of you will have come across them with mindfulness. So with my Apple Watch, I bought one in New York when they first came out. And as the software changed, as many of you will have noticed, so first of all, it told you to stand up. And so the software then said, stand up. Well, of course, it's to get people moving. Then I got one that said a message saying breathe, and I thought, breathe. Well, yeah, you're breathing. That's all mindfulness. And so when COVID struck with the latest version, it reminded you to wash your hand for 20 seconds. And now, of course, if I fall over, it rings up. It's got an SOS on it and stuff like that. And you can see on the course I went on the bottom right on eHealth that already now this course I did about 3 years ago, maybe more. It's already talking about how the watch and the phone not only do your pulse now, they can do an ECG, and now I'm pretty sure the latest version you can also use as a rough pulse oximeter, so your oxygen levels, and there are an awful lot of the technology we can use. So I think this is where I'd pick up my stuff. I think these are audiobooks. Done a lot of audiobooks. Oh, and I can still read, but you can get them to work as an audiobook. So the main one there, I would say, is Nudge. Is quite interesting how we get people to behave. Oh, and there's I'd forgotten about that. So I read Homo Deus. I read them all really, but anyway, the Communist Manifesto. That I didn't fully finish that. But these are very good. So this is marketing. I'd urge you to look at him on YouTube. I find YouTube easier than reading. Most of the larger books basically boil down to a few facts in the end with examples. So the TED Talks by these different people are well worth doing. And this chap on YouTube, this is, I'm not sure I've got it. I think I have explaining how health can work, and it's disruptive innovation, but it sounds very grand. But what you're trying to do is to actually use modern technology to help all of us. Before I did this, you meant to do, and I did do to a certain degree, is find out if what you're trying to achieve people want. And this was with my patients, so clearly they were biased because I'd asked them, but they did answer, and they're not going to use an app every day about their health, but we can use it for different things as well. And earlier this year I went on this course, and the one thing I found out was there was no money for dentistry. So it's not that I haven't tried to get money to get what I would now call a dental health service, but the interesting part here was there is funding available within the NHS for cancer. So I applied for that, and there's huge amounts of money for cancer screening, which I think we can do, and I'll explain that. And the other one is for diabetes and obesity, but there's no money for dentistry. But it doesn't mean we can't, try and get some of their money, which I've tried to do, but unsuccessfully. But really, I don't need it. If we get enough dentists just to sort of engage with this, we can have our own dental health service. So this is what, if you go online and look at Clayton Christensen's YouTube videos, they vary slightly. There's some about how you look after yourself, and he's quite religious. But this is about healthcare. And so when I did it, I was just trying to explain that this is how the cost sort of, as more specialised you become, the cost goes up. But the highest cost, of course, is the big central units. And that is the same as applies to our health system, where they're all blocked up in what is our major hospitals. If only we could get stuff done outside. But that needs long-term vision, which governments don't seem to have. So clearly, there's a thing called NEWS, which is National Early Warning Signs. And actually, the way that works, to be frank, most people could do it themselves at home, just to check yourself for sepsis. So this isn't my field, but you can go to the pharmacist, so you get your cholesterol checked, and then as you go up the scale, then the costs go up. So say that's the hygienist, that's the dentist, and then you've got the oral surgeon. So I did it for oral surgery. So like I say, I made this a little while ago when I was trying to get funding for cancer, oral cancer screening. And so, as I said, the most likely people to refer for secondary care for oral cancer, no one does it in primary care, are the dentists, so that's us. Hygienists also do it, because sometimes the hygienist sees the patients 2 or 3 times more frequently than they see us, so they should be in a position to at least refer, as our therapists. Doctors, they don't refer as many as us because, doctors, quite frankly, aren't very good at looking in the mouth, as we know. But there's what I was talking about with the phone in this instance is if ever you download the app, you'll see there's a scoring system, and it's not really a scoring system; it's an indication. So the phone itself sits outside being a medical device because it gives an indication. It certainly doesn't do a diagnostic thing. However, we can use it, and you can sort of bypass all of us. And as you know, half the adults don't see us anyway. So how can we do that? Well, it's already started. So this is outside the health service anyway. This is a company that I come across, and they're quite a big company, and they do endoscopy. There's a unit in Bristol. So if you want to have your bowel checked, you can go there, but why not at the other end? So in health, I don't know them, but we can have the same thing with the dental app, which is, as you know, is called Teeth for Life. And how would that work? Clearly I got bored with doing all these bouncing ins and out. But you can see there are 2 things. As it says there's a slow and costly way of getting into treatment for your oral cancer, by which time your stage 1 may become a stage 2, which may become a stage 3. Or by the time it becomes a stage 4, you're really in trouble. So if we've got people who are just using an app, at the moment it's called Teeth for Life, but certainly we've got a way of educating the public that they can actually go online and be triaged, which they can via that particular company. I think it was that company. And then you can get a diagnostic unit, and then you get an early referral. The problem with this is always that people are worried that you're going to get too many referrals, but it would have worked, and we just need to think about doing these things. And so that's what I put on my app quite a while ago. So if you download the app and go into the section that surprisingly says in My Care, Oral Cancer and Carers, it shows you how to check yourself using these animations that most of my patients preferred to actually looking in someone's mouth. But so they're all there. And clearly these videos I made, and they take a while to do. It's whether we make something, get a little bit of money and make something that's a bit better, but you don't want it looking too flash, because I think people like to know that you've had some input in it because they trust us. They don't trust corporates, and Yeah. So these are screenshots from obviously from my phone, and so we all use apps to a greater and lesser degree. You can have a look at those that I have there. The medical one, I know that's going to show up soon, but a lot of these apps are about mindfulness and stuff like that. And all the companies, they have other apps that encourage kids to clean their teeth and adults to clean their teeth. The interesting thing, of course, is that they're branded. So there's Philips have one, Oral-B have one. There was the one on Biwi, and that was basically selling toothpaste, really. So they have a branded slant. So the Oral-B, which was £500 when it came out, the latest one. So Christmas is coming, they're probably going to bring out an £800 version. Right, so these power brushes are great, but they're not that great. This food scanner change, that works really well, but do we use it? Can we use it in a different way? I'm sure we can. So this skin cancer, I looked at this must be at least 6 years ago. There were about 4 of them at the time. This is an American company. But the interesting thing is obviously you have to pay for that. Now, if we had an NHS, surely we can do this for free. So this is how the app would work. It's basically you sit outside that circle of having a medical device, and it's just an indication for the person on, what it is. So there is advice on the phone saying you don't come in for every little ulcer that you have, but take a picture, and if it's there in a couple of weeks, go and see the dentist, and if he says come back in 2 weeks' time, if it's still there, you say, well, no, I've done what you've just told me now. I did that 2 weeks ago. Can you refer me now? It's just simple stuff, really. So anyway, I'll play a little bit of this, and I've known from before, when I've talked over things, you can't hear me anyway, but when it gets to a point, I'll just stop it.
The joy of working with Skin Analytics is you've been very reactive with suggestions that we've made.
Integral to introducing AI diagnostics were the clinical photographers who helped shape the design of the smartphone app and took their skills out to patients at community hubs.
What actually this does is it helps us right at the beginning of the pathway on the sort of triage stage. So what we do is we're taking medical history.
All right, so you get the idea. Is that was a device that they just stick on the phone. So when I was said about, I think it was called Healthcare, that company got the unit in Bristol. Well, they would have a camera. Then that's for skin cancer. Well, it won't be long before they can do the same thing for oral cancer, because the tongue is still epidermis, is still skin. It's just teach them how to get access to take the picture of it. These things are. In health, sorry, I'm looking at my own slide, but you can see where they're dotted around the company. These are private companies, right? But they're also funded by the NHS, and you can be sure that they're paid a reasonable amount, a lot more than dentists get paid for a checkup. So anyway, this is how it worked for me, is that the idea was people scored themselves, then it said check yourself for oral cancer. I made a video for myself initially, and it followed their pamphlet, which was a great pamphlet. So all I did was, I had one, my nurse held it up and I just read it, poked my fingers around my mouth, and someone took pictures. Anyway, but this one's far nicer, and she's got a lot less fillings than me. And the other thing then is you set a reminder, right? Now, so there's other things there for like setting a reminder to check your children with disclosing. But I'd certainly say, well, why not check yourself for oral cancer once a month? You can set it at a time. You know all this stuff. And while you're there, while you're out the shower, just cleaning your teeth and whatever, check the rest of your body, and take a picture. Let's start using these devices for other things other than some of the bad things that they cause, as we know, which create the issue about needing mindfulness. Anyway, so that was the video that I made, one of them. There's a really good one, I think, and it shows pictures of cancers, and that was based on the the Van Gogh sunflowers picture that you saw at the beginning, I used that and then I jiggled it around, and you can see how it works to show people, what an oral cancer looks like without being too in your face. And there you can see, these, I think that was from, the table here is from Cancer Research UK, I think. But, actually, oral cancer is the sixth most common cancer. Some say it's the fifth, some say it's the 16th. Generally, they say it's the sixth. And what we're trying to do within health in general is get people to have the right habits. So this video, you can see the one on the right I've made more recently, and it looks, quite frankly, I think it looks better than the one I made on the left. But the information of the videos that are made in the animations, it's the text that I think is pretty good. And if the message I'm giving is incorrect, then I need to know, and then we can change them, and then we can develop them further. And so this is why I'm always saying, give us a hand. It would be nice to get some feedback, because these are all my ideas from, I've always been interested in how we can improve health for everybody. And this again is about how you have a reward. So for children, if you disclose them and you take a selfie and it gets better, or even just stays the same, then you reward the child, and that's how it works. It works for adults too. When they say about the carrot and stick, it doesn't really work. You can only have carrots. Sticks don't work. And so then you don't have to spend money either. A reward can be all manner of things, can't it? Like if you're a child, they can stay up for an extra half an hour. That was a big thing back in the day. If I could just stay up and watch TV beyond 9 o'clock. You just have to be inventive, and the same for yourself. We're not perfect. I'm certainly not. But anyway, this is how but when I first started practice, we used business cards. Well, these business cards, as you can see, they're still great because you physically hand something to the patient, and it has all their details on one side, so it's specific to them. And then on the other side, you put all your adverts. So, that's how it would work. And as I've said before, I'd send an email template. Well, the template set up, I just put the BWEs in, and if appropriate, I would advise on what treatments that I think they should need with a clip for a video, a YouTube channel clip on that. And I think this is a really good way to protect and market yourself very easily. Oh yeah, so again, these videos now, this is a new bit of software that I use. So you have to pay for this software, but it does make life a lot easier. But clearly the images within it are what I've got on the app at the moment. And I do think that it needs changing. I asked my patients and then dived in. Really, I can improve on it, or we can improve on it rather, if we get some feedback from ourselves and people that design these things. So that the banking app that you had from say 5 years ago or 4 years ago when this app first came out, it wasn't very good, and now they're great. We need to do something similar, and that's about how we can copy the good aspects of them, just to make people use the app a little bit more for their general health. And yeah, there's some wild claims here. So this was a bit of a kind of, I just saw this and it was a bit of a joke. If you watch the video, that's the idea, because people listen to stuff if it's humorous. But we do know this. So at the same time, when's this? April this year. So this is a 27-year study, I think, of relating people's dentition to their morbidity, or mortality, as it says there. And yeah, so we know there is a strong link between oral health and general health. And going back to design, I know from talking to the health service and to other people what they would want. So you can do little mock-ups as I've done here. So you got the information. The tooth would be your score from the scoring system. Then you can have it in whatever language you want if you look at the flag. And you can have a search tool at the top. You can have your picture on the front if you want, or apparently people like looking at their own face more, so you just get the patient to have their face on it. And then below it's obviously contact details and sharing. And the little bit on the right I made is teledentistry. really, through COVID, that's what happened a lot, and we should do it. Maybe just have the videos that they particularly want and bring them to the front screen rather than further back. And of course, it wouldn't do any harm to have a shopping cart to try and generate a little bit of money somehow to keep this idea going. So that's what I'm saying is, I've forgotten I've written all this down. So that's why we need funding, or rather, we need funding. Teledentistry, right now, there are two aspects. So when I'm chasing the NHS, it's because they need it, because they need cancer screening, and we can send photos through, as I've explained elsewhere, through to a triage centre. Then you get, so then you get drawn in to go and see someone in one of those units before you get referred on, but the vast majority won't be referred on. So the same teledentistry, we could but have people who would register the public to book with a hygienist, whether it's the one that they see or any other hygienist, just to get updated advice on their oral health. Now, a lot of you think, I'm not going to do that. But you think about it, a lot of physios do this online, and it worked in COVID. It's one of those things, again, is where it's what the public want, is just to get, even their children to listen to you, because they won't listen to a parent. People will pay for this, and they can do it from their own home. You can do it from your own home, and it makes the business, the surgery space at work more profitable again, because you can just be doing treatment there. You can do prevention anywhere, really. So it should have had a history when I did it, and when it's the history, it's the scoring history. Your BPE, that isn't held on the app at the moment, but it should be. And you can do global notifications. It's very difficult to do targeted notifications. It make it a lot more difficult, then you get into trouble with GDPR. So the reason it's GDPR compliant is it's kind of a one-way street. So that's how I designed it for GDPR. So as a practice, you could actually, I think that if there are 10 people using it, then it'd probably be better if you had it as a practice. And if that's the case, then make it more customizable, so that the stuff in My Care and treatment section you could do. So if you're an ortho practice, you probably want something slightly different. And if you're an ortho practice, you can probably afford it. And yes, so we'd end up with a dental health service. So the idea is that people can access this resource that would be a trusted resource because you recommend it. And even if you don't recommend it and someone comes across it who hasn't been to the dentist, at least it should be a reliable resource rather than some of the stuff that's out there. So as I was trying to explain to the health service, when you're applying for your funding, we've wasted billions. Twice, I think, we've wasted about 6 billion on IT schemes within the health service and integrating it. And I was on the LDC for years. It was, honestly, it's tragic the way nothing happens. But if you turn things around and you look at how much people pay on their phone, and it's these are mini computers, they're not phones. So if you look at how many people are using the phone and how much they pay, I tried to work it out, but I got stuck between my billions and my trillions. What I do know is the track and trace cost about 30 billion, wasn't it? And it was used by 3% of the population, right? So this is getting people to use, the money that they've paid out to help everyone. There's a system in there that we can use. And so, what we're talking about is you're delegating the oral health advice. So on that card, that's what I used to do. Generally, there were some hotkeys on the card that were replicated within the app, and people would just press them. So we'd show the design there, the secondary design. You'd move the hotkeys basically onto the front page. And generally the hotkeys would be how to use your electric brush or your power brush, and how to use your interdental brush. And then you probably have 2 for treatment. In which case these days one would be on tooth whitening, and the other one probably, would be on adult orthodontics clearly designed by AI, but you're responsible if it goes wrong. So anyway, so there is a sort of hierarchy of expense. So, should you be giving out the oral hygiene advice when you're charging someone, £10 a minute or whatever you work at? Do we need the hygienist or the health educator to do it? Or do you do it via a phone? And it would be free, really. So, so I know how much roughly it would cost to develop an app further, and I wouldn't need any money from the health service, and it would be our app. It would be our dental health service. Right, but these are the things. So these are my notes from a few years ago, from when I did that course, and I'd recommend you have a look at these future learn courses. They're great, but I think I'd made it. Yeah. So the problem that you have, the whole thing might be rubbish. I went to 3 dental shows. No one said it. Everybody liked it, except one. But you don't use it. And one of the reasons people don't use it is that, is who am I? Well, I'm just an average dentist. But if we could collaborate and we were average, 60,000 dentists who sort of agreed with it, then people would probably use it more. And and what you need is it to promote it. In this case, it would be to sort of advertise it. You need to get it out there. And it is phenomenally difficult to do. I've been trying to do it through social media, but I'm really not getting very far. And it might well be that the product is rubbish, the idea is rubbish, but obviously I don't think so. And obviously, what else, winter's coming, I might do a few more of these videos. Yeah, but that's what I need, is we need just some feedback, and the best way for feedback is peer review. I'll probably do a little video on peer review. It's the best way to keep sane and to enjoy your work. Third-party endorsement. Well, clearly I'm after the NHS. For no other reason than they would then promote it. But if they're not going to do it, then they can't then suddenly turn around and say, oh, it's a great idea, and we're behind it. They should have been behind it and behind prevention 40 years ago. And so if they get engaged in it, should we charge them? No, that'll be a novelty. Anyway, so it says save a life, share teeth for life. That was always on the front of the app, and that was obviously around the note for oral cancer. If you download the app and press the info on the front page, it explains how it kind of works for the public. And QR codes, everybody is used to them. Yeah, so again, that's a copy from Steve Jobs. When he brought out his iPod, they didn't sell it as a product that can play all these different songs and house all this, I think it said 1 gigabyte of songs. It said 10,000 songs in your pocket, and we need to be a little bit clever of how we say in very few words what we want, and I'm very poor at it. But anyway, if there was another group who wanted to take this on board, then that would be great. If from what I can see, that these people are trying to get the whole dental team, and I think that's a great thing. We should, you empower members of your team, and quite frankly, most members of your team, if you're over 40, are probably better at doing this kind of stuff. I meant to change that. So team, I couldn't find a picture of my football team. This is a while ago. I wouldn't trust this lot even now. But we do need a team of dentists, and hygienists and therapists and nurses. So I said I was on the LDC, and not long after this I left. It was because we didn't have the contact details of all the dentists in our area, so how can you communicate with them? And so I asked the GDC if we produce a national LDC website, would they tell all the dentists that there was now a website that had all the details on it about, sort of anticoagulant therapy, steroid therapy, I don't know, it could even include how to do your finances, how to use Xero, stuff like that. So you'd have a few experts in their field who would have a website. And then in the corner, you just have your local details for your local LDC. Because an awful lot of the younger dentists don't even know what an LDC is. They don't even check to see if they pay for it. But yeah, I mean, I wrote this a little while ago, and that was the idea. And I say a little while ago, I think it must be 7 years ago now. Yeah, because at that time, they were talking about how we were going to get quick referrals for oral surgery. And I took digital x-rays for a long, long time, but we could never send them. We had to print them out. And even when I left about 2 years ago, we couldn't email the image. You had to put it you had to print it out on a piece of paper. Now that says it all. It's hopeless. We should be doing better. Oh yeah, so I did I said we ought to do a website, and to be honest, I didn't make this. I found one surprising enough. About the 113 LDCs all have different websites, and why do we do that? It's just a bit of a ball ache doing these when you know not many people will look, but we should have a basic one that we all pay a bit into. It would save us so much money, and just have one person to actually do the local information on it. Yeah, so the only bit of this that I've done, well, I did the text a while ago, but the pictures, I took the photos. So I then made one for carers. That was far more interesting. And so all I've done here is, this is how a dental health service would work, is that if you had some groups of people, not individuals, but groups of people, that then, you can, for instance, most videos that people watch for health or on Instagram or whatever, they wanted everything within between 1 and 2 minutes. So if you want a video on toothbrushing, interdental brushing, diet advice, all these different aspects that we can do short videos for, then if we can agree on the text, then we can make some short videos that we all use within the app or within an email that we send to our patients. But if we all have an input, and when we say an all, it's not an individual, then they're quite difficult, I would think, to come back at us. So going back a stage to when I was asking about the oral cancer, the person I was talking to, I said, what we want to do is to get people to check themselves and take a photo and forward it to you to see if you should get them in to be seen for oral cancer. And the person said, well, it's rather tricky because there might be someone who decides not to come in early for oral cancer following the advice from the video, in which case you or we would get sued. And you think the world's going mad if one person for whom something didn't work stops you actually doing something that may potentially save hundreds of people, then that's not a good thing. From my own point of view, I had my hips resurfaced 14 years ago, and they don't do it so much now. If I'd had them replaced as normal, I would be in a wheelchair. Sometimes we have to do the right thing. Anyway, so that's my idea. It's how we can work together in such a manner that we end up with more spare free time. We can get this modern technology to help us, not to hinder us. And when we're typing these notes, God, I'll do another video on that. But some of the stuff that you have to write because you're worried about getting sued, I would hope in the long run this is what we can stop. So anyway, ultimately you'll end up with a dental health service, and we can have a website for that, we can have an app for that. It wouldn't cost much, it wouldn't take long, but don't wait for the government to do it or the health service to do it. It just won't happen. So we can do it ourselves. And yeah, so I've also did this, so I don't think I added anything to this, but if you go on this, by the time if ever you come across this video, it'll be on this website. And I made it during lockdown because basically as a trainer, every year people come out with less and less experience. And I ask universities for their videos because they must show them. And as yet, no one has sent me any of their videos. But have a little look at this one. And I think that's the last video. Last clip. Oh, no, it's not. So, yeah, so what one provides is a dental health service. And so this is, this is made through Toonly, a different kind of animation. I use Doodly. There's some other animations that are called Doodle Maker that are downloaded by mistake. And there are a lot, soon you'll be able to do lots of clever things, but this is where we're providing a service for everybody, for the general public. And at that time, I think it was about COVID, just saying be careful. And so, yeah, I've just bought this domain because hopefully you will start using it. I don't go on it yet. I haven't put anything on it. But yes, this chap, if you want to cheer yourself up, human behaviour really doesn't change, technology does. So this guy was really the first business professor of business, or a business guru. I'm sure there are others about there, but he lived to a ripe old age. So look him up on Wikipedia. And I just like looking up his quotes. He's got lots of quotes there. There was one I was trying to find that was relevant. The one I like is, if you want to know the future, if you want to predict the future, you do it or something. Anyway, this is why I should never rely on my memory. But this one is interesting with what's going on at the moment. We don't want to be doing the same thing. We want to do something different. And the health, the dental surgery as such probably hasn't changed a great deal. I think even when I left, the turbine I was using, wasn't greatly different to the one we started with. The best thing about a turbine is if you don't use it at all, and that's prevention. Anyway, that's that. Hope you enjoyed that. If not, give you feedback, and then I can change it and make it better. That's the best stuff about IT. We can keep changing it.